the most important way to combat fear is with facts. Late yesterday evening, we learned of our first confirmed COVID-19 case in an individual who traveled from Italy. Our investigation began immediately in collaboration with the State Department of Health with the goal of ensuring that there is no immediate threat to the public of Monroe County. Our investigation is still ongoing and it is in its early stages, and so I will release further details once we can confirm those details and when we can be sure that releasing those details will not interfere with the investigation itself. For now, we are confident that the individual contracted the infection in Italy, and therefore it is not an example of local transmission. As I mentioned, this patient is currently in isolation and will remain so until he is cleared by our department in collaboration with recommendations from the State Department of Health. In addition to the patient, we have made contact with all of that person's close contacts, and we will be taking appropriate quarantine precautions to ensure that those individuals are observed for the appropriate period of time to ensure that they do not become infectious and pose a threat to the larger public. In terms of the details, this is what I'm able to share with you now. We know that this individual flew from Rome, Italy to JFK Airport on Tuesday. He arrived, took ground transportation from New York City here to Rochester. He immediately went home. We became aware of him midday on Tuesday. We made arrangements with him by phone to ensure that he was on self-isolation. And then we worked with Highland Hospital to ensure that he was tested appropriately for the COVID-19 virus. Calling ahead, Highland Hospital took all appropriate precautions. Testing was arranged through the Erie County Department of Public Health. That test was processed and we received news of the test results last night as positive. Throughout this experience, the individual has been extremely cooperative. He demonstrated his cooperation by calling us in advance and following through to the best of our knowledge with his now being on isolation. Again, as I've discussed before, this is not an example of local transmission, therefore the risk to the local public remains relatively low. Going forward, I believe we need to undertake concerted social distancing efforts. First, I want to encourage all the public to reconsider gatherings of greater than 50 individuals, especially gatherings that involve healthcare providers, first responders, and law enforcement professionals. I want to encourage nursing homes to reevaluate their visitor precautions and to strongly consider not only limiting visitation, but also increasing the screening among nursing home employees. I want to call on hospitals and primary care settings to relook at patient access, providing ways to identify patients at risk and taking appropriate precautions so that they do not pose additional risk to other patients in either setting. And I want to encourage all employees, especially those who provide vital services to our area, to stay home if you are sick. I want to again call on local hospitals to further expand access for patient care as well as for patient testing so that we can establish the prevalence of this illness here in our community. And to the public, I want to encourage you to seek care in your primary care office and not to go to the emergency room unless you have an emergent condition. I want to report that the schools continue to have discussions about what they will be doing in the future weeks relative to events and assemblies and whether to close classes. Those decisions are ongoing and we are having conversations with the superintendents on a very regular basis. Parents, I ask that you keep your kids at home if they are sick. On the topic of mass gatherings, although the risk to our community remains relatively low at this time, and we still have only one individual under isolation, we must also acknowledge that now is a time to relook at our habits. I believe that with the St. Patrick's Day Parade coming this weekend, that currently the risk now exceeds the benefit for proceeding with this parade. And in conjunction with the mayor and the county executive, the decision has been made to suspend the parade for now. And I want to encourage everybody to take personal precautions, hand washing, respiratory etiquette, making sure that you try not to touch your face, taking reasonable efforts to disinfect surfaces, especially in workplaces, elevator buttons, stairways, and so forth. Stay in your home if you are sick. Parents, keep your kids at home if they are sick. If you have traveled to any of the 5 countries in question, Italy, China, Iran, South Korea, or Japan, I ask that you follow your symptoms, and if you are in the healthcare profession, definitely do not report to work without contacting your employer. In conclusion, we are entering a very unsettling time. It's very understandable that people are experiencing fear, anxiety, and uncertainty. To combat these emotions, I believe we need to share facts and information, and to do so in a calm and rational manner. We need to recommit ourselves to the importance of science and of facts. We need to work together to prevent infection and also to prevent illness. We all have a role in fighting this emergency. But all in all, I want to encourage the public to take caution, to be calm, to understand the facts, and to work together, because together we will get our way through this in the coming weeks and months.